It was a routine admission for asthma. My partner had seen Sharon in the emergency department the day before, and she was wheezing. Recovering from knee surgery, she was living temporarily with her daughter who smoked and had cats and dogs, all of which irritated her lungs. So it was not unexpected, 4 months after her surgery, that she would have an asthma attack. My partner, Dr. John Bourne, warned her to stay out of that environment and return home. This is what she had planned to do, but it was now too late. Murphy's Law applies to medical practice, just like it does in everyday life. A crisis always seems to happen on a Friday afternoon when you are ready to go away for the weekend. This is exactly when Sharon showed up in the emergency department. Dr. Bourne stopped by the hospital on his way home to see if Sharon was well enough to be discharged. Under those circumstances, it is very tempting to send her home for office follow-up. This is what the emergency department physician was recommending, but Dr. Bourne had a strange feeling that she needed to be in the hospital. He admitted her and called me to follow up over the weekend in his absence. The next day, I saw her for the first time. I could hear the wheezes in her lungs, but she thought she was doing better. I made the necessary adjustments in her medications, reducing her cortisone, which is used routinely for a bad asthma attack. Her chest X-ray showed what looked like early pneumonia, so I added an antibiotic to cover all of the organisms she could have picked up. The next morning on rounds, the nurses reported that she had gotten a little worse, and I was mentally scolding myself for too quickly reducing her cortisone dose the day before. When I walked into the room, she was on the phone. Normally, when I make rounds, patients tell their callers that the doctor just came in and they needed to hang up. I always thought this was a little pompous on my part to expect someone to hang up the phone because they were preempted by the doctor, but it was certainly nice, and it made rounds quicker. This day, Sharon did not hang up the phone, so I pulled up a chair and sat patiently. It was a little awkward when she closed her eyes to listen on the phone. It seemed like a silent eternity. I did not know where to put my hands or if I should look up or down. My mind wandered as I shifted my body in the chair. I thought about her illness and whether I should be concerned about her slow progress. Am I missing something? I dismissed the thought. Then it came back again. Should I order any additional tests? No. But something kept arguing with what I thought was my logical scientific reasoning, and I finally gave in and decided to order a D-dimer blood test. I am not sure why I was drawn to this lab, but it is a test that helps diagnose pulmonary emboli, blood clots in the lung. It seemed a little overkill to me at the time to be looking for a third diagnosis when we had 2 satisfactory reasons for her asthma attack, her daughter's animals and pneumonia. But I wrote the order to relieve my mental conflict and went on to my next patient. The lab was prompt in running it. Normal is 300 or less, but her level was 1800, one of the highest I had ever seen. I immediately ordered a CT scan of her lungs. 2 hours later, I was interrupted by a call from the radiologist. Sharon had showers of life-threatening blood clots in her lungs, and later we found clots in both legs. My next call was to Sharon. I'm sorry to let you know that you have blood clots throughout both lungs. You will need to move to the step-down unit for closer monitoring and be started on blood thinners.
It was the prayer,
she said. What prayer? I asked.
When you made rounds and were waiting for me, my lay minister was on the phone and said a prayer that my doctor would be guided to the correct diagnosis. That's why you ordered that test.
I wondered if it was just a coincidence that I happened to think about ruling out blood clots at the same time that she was praying for help. But Sharon knew the answer. To her, it was nothing short of a miracle. After her internet research, she knew that if blood clots were not diagnosed early, they could be fatal. She was convinced that I had simply been spliced into her 3-way call with heaven. Sharon did well after the diagnosis was made and left the hospital 4 days later, feeling much better. I felt better too, after getting some much-needed help from heaven.